In Health Matters this evening, a man wakes up in the middle of the night with chest pain. He wasn't thinking heart attack. It was pain, though, he'd never experienced before, so his wife took him to the emergency room.
He told KRK4's Suzanne Bruner there he learned he was having a heart attack, but didn't realize it because he wasn't experiencing the common symptom.
It's good to see you.
How have you been since you were in the hospital?
Doing very well.
41-year-old Philip Alaman of Searcy has come a long way in just a few short months.
It felt like that somebody was pulling my lungs through my ribs.
One night after experiencing chest pain, he took some over-the-counter medicine, but the pain didn't go away after 30 minutes. So he went to a hospital in Heber Springs, and then they rushed him to Baptist Health in Conway.
Dr. Gozier, when he got involved, he recognized it as a heart attack and got me to the cath lab.
What's interesting about Philip's case is he thought the pain was stemming from bronchitis he was just getting over, saying the pain felt like indigestion. While each patient varies, arm pain is one of the classic signs of a heart attack. But Philip says he didn't experience that.
His EKG was normal, so it wasn't making a lot of sense. Usually when we see somebody having an acute heart attack, they have fairly definitive EKG changes.
Baptist Health cardiologist Bernard Gozier said despite that, it was important to act quickly and take him to the cath lab immediately.
His blockage was in the circumflex artery, and it was completely closed at that point.
Dr. Gozier used a catheter to place a stent in the artery and cleared the blockage.
Immediate relief as soon as he got the stent in. I could feel the pain start to subside. So it was, he's a godsend.
Now, Philip is going to regular checkups and looking towards a lifestyle to help keep his heart healthy. In Conway, I'm Suzanne Bruner.
And it's important to note if you're feeling some type of chest discomfort, shortness of breath, arm, back, neck, jaw, or stomach pain, doctors say go to the hospital immediately. Listen to your body. We'll be right back.